Hi everybody, Dream Bismark, Chief Executive Officer of New Life Covenant Church, and we are proud to present the day sessions here with this rebroadcast. All the panelists that are here and presented at our conference are experts in their field and are not people to be taken lightly. At New Life Covenant Church, we believe in the people that we have raised in our church, in our own house, and what they're doing in the marketplace to represent the kingdom of God. So take notes, take heed, and if you are blessed by this and would like to get in touch with them on any level for anything to do with your ministry, your business, their information will be made available to you when you contact info@jabulanlcc.org or go to their social handles, which will be presented at the end of their broadcasts. We thank you so much for participating, and please enjoy this, and the overflow continues.
Good morning. Good. And welcome. I believe prayer business has been done. Prayers have been handled. Thanks so much, Drin. Thanks for the introductions. I am Tendai Murisa. I'm with doctors today, so don't call me doc. These are the doctors. These are the experts. So we are dealing with a very interesting topic, a topic that at times is considered as taboo in our society. It's discussed under the carpet for those who know. But we thought, and we're so grateful to Mom and Dad, Bishop Bismark and Pastor Chichi, for giving us this platform to discuss a subject otherwise never discussed in churches. And hopefully today we'll help to debunk some of the myths and some of the confusion and some of the misunderstanding to do with issues to do with mental health. It's an important discussion to have. It's an important issue to talk about. And I'm not going to be doing a lot of talking. I have the privilege and the honor to be working with experts. These are everyday practitioners within our country. But also, it's interesting that even though they're out there dealing with mental health issues, they also happen to be sons and daughters in the house. So this is local talent, homegrown talent in the house to help us deal with issues that we have for years not addressed, for years not looked into. So without further rambling about the bush, I'm going to ask my colleagues to introduce themselves. I know we've mentioned their names, but for many of you, you've seen them walk in and walk past, and some of you see them maybe just as pastors, as counselors, but I've asked them to introduce themselves as experts around this field. So I'll start off with my sister, Vongai. Just introduce yourself, what you do, then we'll take it up from there. We'll go to Dr. Josephat, then we'll come to Dr. Sacrifice Chirisa.
Okay. Good morning, everyone. As Dr. Murisa has already mentioned, my name is Vongai Munatsi. I am a clinical psychologist. I'm registered here in Zimbabwe, and I practice from here in Zimbabwe. I have been a clinical psychologist for almost 18 years now, and it's been a field that I went into out of passion. I started my working with Childline Zimbabwe at a time when people and even my family didn't understand what psychology was about, and there were lots of questions around what the field would offer. But I always had the impression in my mind and in my heart that I was that person who would walk into the room and would see the problems that everybody was having with everybody else. And so from that passion, I felt that I had a lot to offer in that field, and then I started my journey of learning to become a clinical psychologist and learning how to support others in that frame. So I'm very interested in community interventions and developing community interventions that support people that are facing mental health challenges. And in this work, I have worked in many different fields and sectors. I've worked within the government sector, which is where we all start. And then I've also worked within the private sector, and I am the resident clinical psychologist for the Highlands group of companies, which I work with Dr. Chirisa in. I also work with non-governmental organizations to try and create community interventions for different things, whether it's children and adolescents living with HIV, women that are victims of gender-based violence, and many different areas where people face mental health problems and have trauma. Recently, I've been awarded a Top Innovator Award by the World Economic Forum for creating a digital platform for young people living with HIV. It's one of its kind.
Maybe we should clap hands for you.
Yeah, thank you. It's the first of its kind. It's a homegrown intervention using tech and the superheroes concept to try and help adolescents living with HIV reframe negative perceptions of living with HIV. So I would say I have a vast experience working with individuals and corporates, and that's a brief on me.
Thank you so much, Dr. Vongai.
Yeah.
Wow. Dr. Joe.
Thank you so much, Dr. Murisa. First and foremost, I want to thank God for giving me this opportunity to be part of this panel. I want to say thank you to Bishop and Emma for affording me this opportunity. And it's a pleasure to be with you, beautiful, lovely Vongai, and my brother, Dr. Chirisa. My name is Dr. Josephat Chiripanyanga. My stage name is Dr. Joe. Yes. I'm sure if you had Dr. Joe in the radio, on TV, God has opened doors for me in the medical media business. So I'm always on the TV every other 2 weeks, doing Good Morning Zimbabwe, a program that we call Your Health is Your Wealth. Then also on 3K TV, the new TV channel, I'm there every morning, Monday to Saturday. We do what is called Ngari Health Tips, where I do a 5-minute talk about health in general. Then also on ZFM every Saturday, we do a program that we call A-List Health, where we look at the affluent and the health problems that they face. Then also on Power FM every Thursday, we also do a program there. And also on Classic 263 every Thursday, I do a program there.
I'm in the middle of greatness here. And I didn't know it. Wow. Every radio station, literally. Wow. Over to you, Dr. Sacrifice.
Thank you, Doc. First, let me honor Dad and Mom for this opportunity. It's counted a great honor and a privilege. My name is Sacrifice Chirisa. I'm a specialist psychiatrist. I got interested into the world of psychiatry early after qualifying in 2002. So I've been in this world since 2002. And it was after I lost 2 friends of mine. One early while we were in medical school in final year. I lost a friend of mine. We actually went out on a Friday. And when we came back on a Sunday, he shot himself with a shotgun. And the parents were asking us, or asking me, because he left his satchel in my room, and was asking, did you not see anything? Did he not tell you anything? And we did not see. It's only on hindsight when we remember, because that Friday he was asking and said, if you want to kill yourself, where should you kill yourself? And as medical students, we were there, and we gave him the best place to place. And on the Sunday, that's what he did. So at that funeral, we were not wanted. We were there, but everybody was looking at us with these are the cause of all this. A few years down the line, we did not learn the lesson. The second one then died from an overdose of drugs. We were together in high school. We were together at university. It got married, and it got me to think that something needs to be done. And when I went into that field and said I want to be a psychiatrist, everybody was asking why. Why can't you be a neurologist, a gynecologist? Why can't you be this? But it's because of the kind of pains that I had seen, and said, look, there must be a solution to this. So over the years, I qualified in my master's in medicine in psychiatry. I was the only student. In fact, the reason why I'm still in the country while these skills I needed elsewhere is because I was part of a training program that from King's College to increase African capacity. At that time, there were only 4 psychiatrists, old psychiatrists, who had come from the UK, and so I was part of that development program, and I was the only student in the country. So I learned the whole 4 years by myself. So I had to attend every lecture, nobody to copy from. I had to present. It was tough. I almost let it go, and my wife can testify and said, look, I don't need this. I was doing well as a family practitioner, but I then ended, and in due course, I then became the chairman of the largest, one of the public hospitals, as the chairman of the psychiatry department, and I pride myself because at that time, we employed for the first time the first clinical psychologist in government. We had to push because it was not considered. This has been a neglected part, not only in churches, but also in government. And having done well there, I received a call one day and was told that I need to represent Zimbabwe in Geneva. And I said, and I was given, I had to read what I had to represent Zimbabwe on my way in my flight to Geneva, and we had gone to pitch for the first substantial WHO funding in mental health, and I'm happy to say that we managed to get it.
Wow!
And it was so amazing. It was a good experience, and up to now we are still using those funds. And I was then made the deputy director of mental health services in the Ministry of Health at the head office, in charge of all mental health services in the country. And while we were there, we managed to push, especially on the drug issues, which is one of my passions, where we managed to ensure that the country has got a drug master plan. We also wrote treatment guidelines, which are in the public domain before I left, and where I'm now, before I was headhunted to be the general manager for CIMAS private healthcare, where I am now working. But somewhere in that line, we also managed to establish the first private psychiatric unit in Zimbabwe. It was never done. It was a feat in itself at that time, where we were asked, what do you want to do? And we had to write dossiers of what we were trying to do. And we are happy that currently we have opened over 3 private psychiatric units, drug rehabilitation, and we have managed to help others to set. So in a nutshell, that's who I am.
But
I had left one thing that Doc had asked me to say. I am a founder of a ministry called Wisdom City Ministries, a son to bishops, so I'm an apostle. And so it's a unique, combination where you're working as a psychiatrist and at the same time in the marketplace, at the same time leading a church. Thank you.
so you get it. We are not here to party, to play. These are serious voices. They are needed elsewhere, but they are here today. So this is a very important discussion we're having, and thanks for that introduction. There are many nuggets and there are many issues that we'll try to follow upon around policy, around challenges, the number of psychiatrists we have in the country, etc. We'll get to that. But to kickstart our discussion, let's just define terms. What are we talking about? What is mental health, Vongai?
Okay. Thank you, Dr. Murisa. I think they bullied me. You can see I'm sitting in the I'm sitting in the midst of all of these men. And they made me start first, and you can see that they're honoring the lady, but they're making me take all the shots first. And that was the practice even then, that the ladies would go out first to preserve the men. And this is where honor ladies came from. And you know, and I was the honored lady and I got out first. I forgot to do a very important thing, which is to honor my mom and my dad, Bishop Tudor and Pastor Chichi. I'm a daughter in the house, the head of the NLCC counseling team, and they've given me that honor and that privilege, and so I'm sitting in this space in that realm as well. So as I talk about mental health and define mental health, I think this is one of the things that is very important, and a lot of the times people confuse mental health and mental illness. And the moment somebody just says mental, you know, within our systems and within our communities, people already start thinking about somebody losing their mind, taking off their clothes, running in the street, talking and speaking about things that a lot of people don't understand. And that's our idea of the word mental. But when we look at the concept, when we are saying mental health, we are simply saying it's a state of well-being. And I want you to listen to all of these sort of attributes that come with mental health. So the thing is, it's a state of well-being, firstly, in which a person is able to do their best. So we say you've got mental health when you are able to do your best. And then the second thing that shows us that a person is able to do that, has got mental health, is that they can cope with normal stresses of life. So mental health is a state of well-being in which a person is able to do their best, in which they are able to cope with normal stresses of life. And then we add to that definition as well, in that when a person has mental health, they've got good relationships with others. And so mental health and relationships sort of coincide and work together. And then we go deeper in that when you have good relationships, you are also then able to function, whether it's at work, at home, and at school. Sure. And then we close that definition by saying you are then able to fulfill your potential. So mental health, state of well-being, in which a person is able to do their best, cope with normal stresses of life. They're also then able to have good relationships, function at home, work and school, and then live up to their full potential. So in that definition, we can then see mental illness. So mental illness is the direct opposite of all these attributes that I've spoken about. So when you're not able to do your best, you have mental illness. So let's do a quick survey, and I want you to answer this in your own mind, right? You don't have to tell anyone about it, but we can do a quick assessment right now as we are sitting here. And then we say, in the last week, have you been able to do your best in all of the domains of your life? If that's true for you, then that's fine. If it's not, give yourself one. Right? Mm-hmm. Then the second thing is, were you able to cope with normal stresses of life? And then someone will say, what are normal stresses of life? Getting up in the morning is a normal stress of life. Taking a bath is a normal stress of life. Right? Sure. Eating is a normal stress of life, and finding what we are going to eat. So in the last week, if you've been hounding the kids or anybody in the family and saying you're using too much cooking oil in this house, you're using too much sugar, you put in 3 teaspoons instead of 2 or maybe 1, do you not know that sugar is expensive? Do you not know what the rate is and all of those kind of things? Do you not know that people are actually going to work to make this money and buy this food and all of those kind of things? You've struggled to cope with normal stresses of life. Because eating is a normal stress of life. Right? Wow. Right? So if you've struggled to cope with normal stresses of life, give yourself another point. You're number 2 now, right? Right? And then the next thing is we are going to go to relationships. How have been your relationships in the past week? Have you had any problems and challenges, struggles? Usually I kind of talk about, the totem of Achiera or Achielele within our natural context, and how Achiera is known for aggressiveness, violence, and all of these kind of things, and difficulties with relationships, right? So in the last week, have you had any brushes with anyone, whether it's at home, co-workers, and all of that? If we've had any of those brushes, let's give ourselves, another mark there, and we are now at 3. And have you been able to function at work? Number 4. Have you done your best at work, at home, and at school? Depending on where you're finding yourself. Can you say that I functioned well? I did what was expected of me at home, at work, and at school, and everything was fine. If not, we give yourself another tick there. You've got 4 now, right? And then at the end, did you live up to your full potential? If you look at yourself and where you have placed yourself in your life right now, and you look at your potential, did you live up to your full potential? If you haven't, then you've got 5. Which means that, and it's very difficult for all of us to kind of not have any scores in that definition, including me. Yeah. I'm a clinical psychologist, and I struggle with all those factors of life and of mental health, which means that mental illness is something that is very low-hanging and that anybody can have.
Wow. So we are all in a hospital here. Because I don't think there's anyone who scored anything less than 3. So when do you start keeping people at the annex?
You see, so this is the important thing, because a lot of the time there's a lot of undiagnosed mental illness within, the church, the family, the country, and the community. In Zimbabwe, statistics actually say for every 10 people that go to a healthcare facility, 3 or 4 of them have got a mental illness, but they don't know about it. So if we're going to just count in here, we would find that there are lots of us that are having problems without us actually knowing about it. Sure. So we start at the level of stress, and then it goes to things like burnout, and then it grows into something that's even bigger. Sure. But I'm sure Dr. Chirisa and the other panelists will shed more light.
Most definitely. May I come to you, Dr. Chirisa? How are we talking about mental health? Both within the church, outside the church? Are we talking about these issues that Vongai has just raised?
Doc, we are not. But let me just piggyback on what Vongai said and give you some shocking statistics that are key. WHO says that 1 in every 4 adults will suffer from a mental health issue or is suffering from a mental health issue right now in some form or fashion. Now, don't count 1, 2, 3, 4. It doesn't work that way. You might actually be 4, 4, 4, 0, 0, And sometimes I think it's also important, as I answer your question, to come to define that we define mental health issues into 2 main groups, and I would divide them into what I call the major and the minor. Now, the major ones are the ones that we are able to see. When somebody starts to have those things, we all see that something is wrong. So if somebody starts to remove their clothes in here right now, we don't have to say, is this mental or is this what? We can see that something is wrong. So that's a major thing. And so the major issues are easier to see. And these are the ones that are usually brought to the annex, and because they are hitting people, throwing stones, eating from bins, and that's where you've got your schizophrenia, your bipolar. We will give you some of the things to look at. But more so, what most people are suffering from are what are called minor. The minor ones is you look well. If you look at your neighbor, they look so well, so pretty, so handsome. Some fearfully and wonderfully made, but they look the part. But they've got issues that are going. Somebody tonight did not sleep at all. Somebody did not eat. Somebody is having a palpitation. Somebody was crying before they came, but they are smiling right now. And those minor ones are the ones that cause more pain, because a lot of people suffer from those without knowing what to do and without having somebody to talk to. And that brings me to the conversation, that we are not having mental conversations anywhere as a nation, in our families, more so in our churches or ministries. And it's all because when we talk about mental health, there is a lot of stigma. And we have stigmatized mental health, more so in the church, where our explanatory method of the cause of these, and one of us will delve into that, is we talk and say, if you've got something, it's demonic, and even if you're a traditionalist and you're here, you also say mamepo, or it's spirits. So we explain life in the same way, Christian and African tradition. And because of that, we don't come out and speak, because we are afraid to be judged, we are afraid to be stigmatized. So I have seen people that will lock up their relatives in the house, not bring them out, because they don't want people to say that they've got somebody who is suffering from mental illness, so that people will not say they are using him as a charm or to make money. So if you are prosperous and you've got mental health issues in the family, people will say you have used that person to make money. But one of the things that I have also to say, and maybe leave time to a moderator, is that we have seen mental health issues not only in it cut across nations. It cuts. These statistics are the same in families, in communities, white, black, yellow. It doesn't matter which race you are. The statistics remain the same. And I usually throw a challenge and say, if this is Chivanu or African witchcraft working and all that, why does it happen to white guys, or why does it happen to Chinese in the same way it's happening here? The only thing is that when it's happening there, you suffer mental health in the context of your community. So if in Africa you start to say, I was flying in a broom. In Japan they will say the flying saucer came to take me, because it's their context, but it's still the same thing. So we are not talking about it because of the stigma.
The stigma. We'll come back to this stigma issue because it's very important. Dr. Joe, I'm using your stage name. What are the triggers, as a family practitioner, maybe you come across many cases, what are the stigmas to say there's an issue to do with mental illness, mental well-being?
Thank you so much, Dr. Murisa. Before I answer that, I want to add on the issue that Vongai was trying to allude to. We actually say there is a very thin line between normalcy and mental illness. So it's very easy for you to tip from one side to the other. And most people tip without even knowing. And coming to the triggers, I'm just going to subclassify them into two classes. One, health triggers and social triggers. There are plenty of triggers, but if you put them in these classes, it will be easy for you. We see that there are a lot of health issues that can trigger mental health illnesses. Things like chronic illnesses. People are suffering from renal complications and they're now on dialysis. They are easily tipped into depression because now they are losing a lot of income, because dialysis on its own here in Zimbabwe will cost you about $2,000 a month. So that is a lot of money that is going to be forked out, and you're going to be losing 2 days a week at least for you to be on dialysis. So that is going to take a lot of strain on your mental capacity. So it can actually tip you into depression. Chronic conditions, cancer, be it you suffering from it or your family member or your loved one, can tip you into depression and mental health illnesses. So health conditions can actually tip you into mental health illnesses. Then also social triggers. We've seen there has been a surge here in Zimbabwe, like in the past month or so, of suicides, particularly amongst men, because of social issues. Your wife, your partner is cheated on you, and people take their lives. And medically, we say for someone to commit suicide, it's a clear sign that they had mental health issues. So all these suicides that we're seeing, people laugh in social media, but it's actually a sign of mental health issues. So social issues are a trigger, be it relationships or even loss of a loved one. You can lose your mother, you can lose your father, your son, your child. That can also tip you into depression, and you get into social health issues, mental health issues because of social issues. Then also on social issues, finances are a big player, especially amongst men. And we've been discussing outside there, men are at a higher risk of committing suicide compared to women. Women, they are more parasuicidal. By parasuicidal, it would mean that they attempt to commit suicide, but they don't necessarily get to kill themselves. But with men,
Wow, this is deep.
Yeah, with men, if a man tells you, my friend, like Dr. Chirisa's friend told them that, how can I commit suicide? What's the best place to do it? They mean it and they will do it. If a woman says, I'm going to commit suicide, maybe they just need attention. But with men, with men it's generally very serious. And mainly with men, it's financial issues. So you might see someone who's successful, they've got a big company, they're doing well, and then the next thing you hear, they committed suicide. Maybe they got into debt and they're failing to manage that debt, but they are not showing it up. They're putting up a brave face, they're trying to put food on the table, sending their children to the best schools in town, but yet they've got a lot of pressure. Inwardly, they are suffering. So these are some of the triggers. So please, if you are going to be able to manage these triggers, it's going to help you in the long run. If you exercise, if you eat healthy, if you diet, you minimize the chance of suffering from things like diabetes, hypertension, that would lead to things like chronic renal conditions, that will lead you to dialysis and depression. Eventually, that could lead to suicide. If you're also having social pressures, you're failing to take care of your family, or maybe your business not doing well, you also need to talk to people so that you'll be able to manage the situation. So please, at the end of the day, you should not self-destruct, but seek help.
Yeah, I believe there is in my house we call it a clap back, but this is a comeback. So I believe, Vongai, you want to talk more about the gendered patterns of triggers. It's very important for us. But also I want you, if you can, please, help us with the stigma. How do we deal with the stigma issues that Dr. Chirisa raised? Yeah.
Thank you so much. We were talking about gender and all of these things, and even with the mics, they are gendered. You know, for the men's lapels, you know, they fit nicely and everything, you know, and there's lots of things around gender that we would need to get into. But with mental health, like what Dr. Joe was talking about, we do have men being at a higher risk of committing suicide than women. And women, a lot of the times, trying a lot, but not really succeeding, mainly because of the agents or the things that they use to sort of try to commit suicide that are not as strong as what men would naturally use. So I would say a lot of the times we do get a lot of that where people are saying women are trying to seek attention, or it's attention-seeking behavior, rather than people actually going deep to understand the depression that is behind the suicide attempt. Because the basic truth is that when we are all well, we do not harm ourselves. If I was to sit here and say, oh, let's bite ourselves, how many of you would actually literally bite themselves and take off flesh on their hand or anything like that? Naturally, we don't harm ourselves when we are well. And so a lot of the times we see these cries of help, but because community, and as part of that stigma, looks at some of these behaviors as attention-seeking behavior, it then makes it difficult for people to then actually go to the depth of the pain. And there are also conditions that are gendered. Like, for example, depression is more prominent in women, and this is why we see a lot of attempts of suicide from women. And then for men, a lot of the times we see a lot of substance abuse, which is actually self-medication for depression, because men are not allowed in terms of patriarchy and in terms of socialization in our society and community to have depression or mental health challenges. So you have statements like, "Kufa kwe murume kubudaura." So a man must be strong. By the time he shows that, you know, there's something that's going on with him, his bowels and his guts and his intestines must be coming out. So we raise our children and we tell them, boys do not cry. And so we are instilling in them these things where we say, you must be strong, you must not talk when you're having challenges, you must keep it to yourself, you must work on it, because that's the sign of manhood. And so they carry a lot of things, and in the long run, like Dr. Joe was saying, they then end up taking their own lives because they don't have anybody to talk to about it. And so we see the differences in the different spaces or in the different genders. So it's not so much about attention, but more about the depression, and that women are more likely to have it, and women are therefore more likely to have more suicide attempts, but then they use different agents and things that are not as strong as what men would use. And we also then find that sometimes as well, because women are more social beings and they talk a lot, they also then share with their friends quickly, which also increases the rate of them being found and helped, whereas men do not share. And so a lot of the times they minimize the chance of rescue because they don't share. Whereas a woman will be talking to everybody, and even on social media, and saying, it's enough now, I'm going to die now. And we are going to, and we are going to send, and we are going to call all our friends and repeat the same story. And then all our friends are aware. And so by the time we do it, we increase also the chance of being rescued and being supported and being helped. I think I also then want to add to the issue in terms of stigma and how people then look at mental illness as izinto zamakhiwa. And this is one of those things that we've had within our own African context, where we say these are white men conditions and these are not conditions that people can have. So you find that a person is depressed, they are not eating, they are not sleeping, they are not functioning, they are not cleaning their house and doing the things that they are doing. We say, there is something about the narrative of mental illness and all of these things that then leads people to say it's not real. This person is not actually ill or sick. They just are not motivating themselves to do it. And so we are always talking about the motivation thing. And we are always saying, you must feel better. And especially in church, we will then start saying, make your confessions, make your I ams, and then they will help you to feel better. And therefore, we then silence people when they're actually really deeply struggling and they're ill, because it's not something that we relate to, and it's not something that we are saying is real. And therefore, they also start feeling that what they're going through is not real. And so we create these environments that then make it difficult for people to then open up about their illness. And then we also then use Christianity in sometimes to then say a person who's a Christian must not be ill. A person who's a Christian must not have mental illness. And so we then put a high standard for Christianity that's not even a God standard, because the first counselor himself was Christ. Unto us a child is born, unto us a son is given, and he shall be called Wonderful Counselor. Amongst the attributes of Christ himself, when we spoke about Christ, he was called a counselor. He was the first psychologist. Do not be conformed to this world, but be ye transformed by the renewing of the mind. The healing of the mind is not a man-made idea. It's a God idea. So all of these things, so all of these things that we are doing, and we are saying we are within the frame of Christianity, we are actually outside of the frame of Christianity, because God himself is concerned with your broken heart. When he was talking about, I'm anointed, to heal the sick, to heal the brokenhearted. He was talking about that broken heart, and he died for that broken heart. And yet you say to yourself, I cannot go to see a psychologist because then I'll be weak. I cannot tell people that my child is on drugs. I cannot say my marriage is failing. Because, if I say that, then everybody within church is going to look at me in a particular way. And so the stigma then stops us from getting help. So I'm speaking about this almost in a roundabout way to almost sort of give us knowledge to say, even within Christianity, it is okay for us to get help. Even within the frame of just life, it is okay for us to get help. And we are the ones who need to start giving ourselves permission to get help. We need to start giving our brother the right to come and see a psychologist, the right to say, I'm not feeling well, the right to say, I can see certain patterns of behavior within myself that I think I need help for, and not be judged by that and for that. Christ said, they that are not sick do not need a physician. And so we must be careful that with the stigma narrative, we might be becoming Pharisaic in the way that we are approaching mental health, and therefore then drawing people back from getting access to something that Christ died for. So above dying for our spiritual well-being, he also died for a thought revolution, for that mind to be well. Before people and even psychologists spoke about self-actualization, Christ was the first person to talk about self-actualization. The Weos, the Son of God, the perfect one, the perfected one. So you being the best version of yourself didn't come from a psychology book. It came from Christ itself. And the founding fathers of psychology were Jews. So when we look at these dynamics in church and all of the places that we are in within the marketplace, psychology, mental health, getting healing is not a shameful thing. It's the thing that's going to take us to the next level and make us the best that we can be.
Fantastic. I knew it. We're going to land it. We are landing it. And it's happening. Thank you so much. And I think it gives us a segue into the next subsection of our conversation. I want us to talk about the elephant in the room, the church, Dr. Chirisa. And there are pastors here. When does it cease to be a demonic attack and it's a mental illness?
All right.
When do we move from deliverance prayers to treatment rooms? Maybe you can just help us about how the church is handling this.
Wow. That's a very common question, though.
Yeah.
And when I've had so many people come to my rooms and that's what they want. And I've had people referred from all kinds of spiritual houses, Pentecost's, non-Pentecost, non-Christian, and then they come and say, look, we heard that you are a pastor, so we think this is spiritual. So the first narrative that you hear, especially from people of color, is that this is spiritual. When the white community comes to me, they are not even talking about spirituality at all. It's zero. And they are suffering from the same issue. Now, while I attempt to describe how I then decipher that, I want to talk about a bit what Dr. Joe talked about. What I want you to understand is that you as a person, you live in dimensions. You are a dimensionalist, whether you like it or you don't. You've got your physical dimension, which is your body. If anything goes wrong in your body, it can trigger emotional and psychological problems. In fact, I want to say that every human being and every male, every child, no matter how small, no matter how old, we are all emotional and psychological. Okay? And these things which are happening in these specific dimensions are affecting us on a mental health, on that psychological tip. So, for example, I will give you, and if you are diagnosed from here that you've got a cancer which is not operatable or not treatable, and you are dying in 9 weeks, you cannot tell me that you will not have any mental issues or stress. I've just experienced that with my own sister. She passed away 2 days ago, and we were told in April that she's got 9 months to live, and we did not get to the 9 months. How would you feel? That's the physical dimension. You've got your financial dimension. You were doing well. Some of you are not even doing well. You were hoping to be doing well, but you are not doing well. You are under pressure. The pastor next to you is doing well. They are driving the car. You are driving a motor car. You understand what I'm saying? And so you've got pressure. The other dimension is spiritual. Spiritual issues. You know, those things that have made you to go to the mountain every week. Those things that have caused you to fast every week. And they seem to be stubborn and not changing. You've got your social issues, your relationships. These relationships start with relationship with your spouse, relationship with your kids, relationship with your in-laws, relationship with your siblings, relationship at work, relationship in church. Relationship with the usher, who makes you to sit there instead and you want to sit there. Let me say this, after having said academic, people struggle. I've seen so many students struggle, come back, crash in the UK, crash in South Africa, crash right here. I've seen Form 4 students crash because they could not get a pass in science, or the parents said, you are going to be a lawyer. The guy wants to be a chef. And we force and push that thing down their throat, and he doesn't want. And he will crash. Now, listen to what I'm about to say about this, about all these dimensions. They are there. And everybody has got a crashing point. No matter who you are, no matter what you are, there is an area that you will crash. Now, what we do is we then judge people, Doc. If you might crash on the social issue, and the social issue that you are crashing on, you are having a bad marriage, God forbid, you are crashing on that one. I have got a bad marriage, I'm not crashing. Then I will say to him, you know, it doesn't matter. Because that's his point of cracking. But that's not necessarily your point of cracking. And so somebody will crack on a financial issue. That you, when you hear it, you say, what is this? If you don't have a car, just catch the combis. Just walk. I walked. But somebody will crash because of that. I've seen people come and say, we used to go to New York for holidays. Now, we are going to Victoria Falls. Oh, Lord, where are you? Because what matters to an individual differs. It differs from how we were brought up. It differs from our exposure. It differs from our aspirations. It differs. So until we appreciate that you are different from the person next to you, you are different from your wife, you are different, we will judge one another. And that judgment is what is making us kill one another. We are murderers. We have murdered somebody because we thought because they are not like me, they are bad, they are not strong enough, and you have been a murderer.
Wow. These are very powerful words. Wow.
So when you then go into the Bible, I thought, Vongai, you were a preacher right there. When you go into the Bible, you then see Moses crashing and say, I'm tired of these people. God doesn't tell him to go and pray. God comes down and talks to him. When Elijah was saying, I'm the only one left, throwing a fit, God comes and says, no, you're not the only one. God didn't say, go and pray, go and fast. He said, no, listen, you're not the only one. What was he doing? He was having a conversation. And that's what we do. You pay me to come and see me. I don't touch you. We just talk. Because talking is ventilation. It's letting I'll just let somebody say whatever they want. They would have paid their money and I just listen and say, tell me more. After they're finished, they'll say, I'm better. And as a clever marketplace person, I'll say, I need to see you in a week for another conversation. But that's what God did when Peter decided to say, look, I'm done. Because when Peter denied Jesus, he cried.
Yeah, he was broken.
Do you think he wasn't affected emotionally or mentally? Why would a grown man cry? He was crying and he deserted, went fishing. When Jesus met him, he called him and spoke to him. So the answer is right there in the Bible. But we do not want to follow it. And it has caused great pain. My biggest cry is that there are so many people suffering right here. And my heart goes especially to pastors' wives. My God, that those people, they suffer.
Sure. I'm not looking. I'm looking here.
When people are honoring the men of God, they leave the woman of God. When they are buying a suit for me, they never buy a suit for my wife. When on my birthday, my wife has never been given a bigger gift than me.
Sure.
As if she is not important. I then have to come up and cover up. And we have seen pastors kill themselves. COVID exposed our lack of preparation in the mental health issues everywhere, not only in the world, but also in church. And that's why I'm so glad and so happy, Bishop, that today you allowed this conversation to go on air, that it's time for us to speak the mental health issue. I think I've forgotten my question.
Yeah. I was coming back to it. I wanted you to, because you are a unicorn in our world. You are a unicorn. You are both in psychiatry and also you are a pastor. My question was, when does it become the responsibility of the church?
Okay.
When does it move to become this listening deal? And we need to talk about that because, people mistake me for Chirisa now and again, so I can also listen. I can also do the listening.
All right. So, here's the thing. We can pray for HIV to be healed. And there are testimonies of people with HIV that got healed. And there are people with HIV infection in church that are taking medication. So shall we say, this one has got a demon of HIV and this one does not? We've got people that have been healed on numerous diseases. And some have to take medication. I believe that medicine is part of God's wisdom for this, for humanity. How medicine has actually developed. In the last days, knowledge shall increase. And we have increased in so much knowledge in terms of medicine. So for me, how I look at it, Bishop might correct me, is if there is a river to be crossed and there is a bridge, I might decide to say, Jesus walked on water, so I will walk on water. But God has given us the wisdom to build a bridge over this river. I don't think it's faith to say I'm going to walk on water. I don't think it's more faith to walk on water than less faith to walk on the bridge. I think it's wisdom to walk on the bridge because the solution is there. So my world, my philosophy when I deal with these things is that let's do what we can humanly do and allow God to do what God can only do. So when it comes to any disease as a doctor, I will approach it from a scientific way and say, do we have a natural solution for this?
Sure.
If there is, that's going to be my first port of call. If the natural port does not deal with it, then I will then transcend to go into the spirit world and then deal it at that level.
Okay.
But if we've got a solution for a problem in this physical realm, and God has already downloaded that solution that we can use, that's what I will use. So how do I then defy and say, do I pray for this one? Do I put medication?
Yeah.
Do I do psychotherapy? It's exactly that. So with my patients, what I do, when somebody comes, I know that all evil comes from the devil. But he will use systems of this world, and if we've got a system to counteract that, we'll use it. So I will see you in a physical doctor, no prayer kind of approach. And I want to say that most 99% recover with that model. It's only the 1% that will then say, you know what? Let's support this with spiritual power and prayer. Okay. And take it. So there are people that will need to be cast out. There are times, but I've heard bishops call me and say, we have casted out the devil. Now go and see Dr. Chirisa.
Okay.
So we don't negate the spiritual part.
Sure.
It's there. We need to deal with it. But let's not our spirituality negate the wisdom that God has given us.
Okay.
And that wisdom that God has given us is also spiritual. Yeah. And we should use everything in our pot to help each other, to help the next person. Thank you, Doc.
Fantastic. I think that balance is necessary, and I hope pastors and those who lead churches, those who are in counseling, received it, because it's very important. I think we'll come back to it towards the end. Dr. Joe, as a family practitioner, cases presenting themselves before you, detection of mental illness, etc. What are the numbers? What does it look like? What are you doing?
Yeah, it's very difficult to diagnose mental illness. Like I said, there is a thin line between normalcy and mental health issues. So it means someone will come in with some other condition. Maybe one of the main presenting symptoms is insomnia. They'll come and be like, Doc, I can't sleep at night. Then when you start talking to them, you see there's mental health issues that needs to be addressed. Or they come with elevated blood pressures. And when you look at it, it's actually because they've got psychological or social problems that are actually triggering the hypertension. And eventually you manage the hypertension, and you also need to manage the mental health issues. It's very, very rare. Like Vongai was asking you guys to take an introspect into yourself, for you to say or tell yourself that I've got mental health issues, and you walk into my rooms and you be like, Doc, you know what? I got mental health issues. It's never like that. It's never like that. They come with other issues. Then as we're talking, then I pick out that there is a mental health issue. Then I have to direct you towards that line and ask you social issues. Don't you think you've got social problems, financial problems, marital problems, or any other problems? Then you start opening up. Then once you open up, then I can now be able to help you. Because the other thing with mental health issues is one of the symptoms is the lack of insight. People are in denial. If I tell you straight out that you've got mental health issues, you'll be like, no ways, Doc. And the next thing, you change shop. You go and buy it, okay, you don't come back to me because I've accused you of mental health issues. So we take our time and talk. One thing about mental health issues, like Dr. Chirisa said, we need to converse. I give you time to talk, then you open up, then I lead you, and then you eventually realize that there is a problem along those lines. It's different from things like an STI, where I can definitely tell you that, my guy, this is a discharge, you've got an STI. And you can both agree with ease. But with mental health issues now, people don't want to accept with ease, and also the symptoms are not as florid as these other physical conditions. And that's where the issue of witchcraft and stuff come in. Most people believe that if you're having mental health issues, it's because you've been bewitched or there is some spirituality to it. The truth is the mental health issues are physical. Yes, spiritual issues do play a part to some extent in anything. Even with HIV, there could be spiritual issues. Any other medical condition, there could be spiritual issues. But when it comes to mental health issues, us as black people, we put spiritual issues at 100%. It's 100% spiritual. You don't need to give this person medication. We need to take them to a sangoma, or we need to take them to church for prayers. But the truth is, the symptoms are vague and they're difficult to detect. And once you get the symptoms, and also I want to implore the relatives, and if you are friends with someone that you think they could be having some mental health issues, maybe they're now depressed, they're not eating as much as they used to eat, or even at times some people with depression actually overeat. So if you see someone is changing their behaviors, so please just coerce them, encourage them to come and see the doctor or the psychologist. Once they go through the counseling and we talk to them, eventually they will get to accept. It's a matter of time before they accept, but they need time for us to talk to them and for us to persuade them. And we tell you that, I think probably, don't you think probably you've got some mental health issues? At first, people will be like, no ways. But as we talk, and then eventually you open up, and then you accept that there is a problem. And once the most important thing is acceptance. If you accept there is a problem, then the solution will come. But if you're still in denial and you refuse, then the problem is going to continue to compound and to multiply, and eventually you're in the streets, or you've committed suicide. So it's very important for us to identify these cases. If you've got a relative or a friend or someone that you think they're not doing well, maybe they've got a problem, talk to them. If you see they're not improving, from your conversations, take them to someone professional, a psychologist, a medical practitioner, and then we talk to them. Usually that way we eventually make a diagnosis and we're able to help the patient.
Fantastic. Thanks so much, Dr. Joe. I think at some point during this conversation, yourself and Vongai may need to flight these sort of services we have at NLCC around counseling, etc., so that there could be some people who don't know what we are doing. So it could be good for that. But I just want us to pivot. I want us to now discuss, which is actually what I was asked us to focus on, prosperity and mental illness and well-being. But I want us to start from the other side. You know, we are living in very uncertain times, a very harsh economic environment. Vongai, I want us to just lay it out for us to say, how are men and women affected by the environment, the microeconomic environment, the challenges to do with employment, a collapsing economy, challenges with livelihoods, etc. Are there gendered patterns of how men and women are affected and how they respond? Then we'll now look, once we've done that, we'll go to the other extreme as well to say, how do you deal with pressure at the top? Okay.
All right. Thank you.
I see your mic issue has been resolved. Is that better? Better gendered?
I'm not sure about the gendering. Yeah, but it's a good mic. Thank you. I think there's so many things like Dr. Joe was talking and saying that there are many sort of signs and symptoms and many things within the community that can help us to see that there are things that are not going on well. And, the impact that our environment sort of has on us. And we were trying to lay a foundation and help people understand that the things that they're facing on a day-to-day basis are things that can actually affect their mental health. And men are affected in different ways, and women are also affected in different ways. But what we then find at the end of it is that all people are affected, or their mental health is affected. As Dr. Joe was talking, I was actually thinking about children, because also a lot of the times our adolescents and our young people and even our children are affected by some of these situations, but we also then don't see it. So maybe starting with some of the signs that we can see even within our children, and then going to the women, and then also going to the men to just share briefly on how people can be affected. Children, a lot of the times we see a lot of changes in their behavior, and I will reference COVID as one of those things that you spoke about, because that was the time when a lot of mental health issues sort of came to the fore, and people could actually see that they used to believe that mental illness was for the other and not me. But when we were in lockdown and you couldn't go anywhere, and we didn't have our usual supports that we had, which is that we could go to work, we had a routine that we followed, that were all protective factors. And we need to also then understand that, our routine, waking up, going to work, going to spend time with our friends, are protective factors for mental health. But when all of that was taken away from us, it made us extremely vulnerable to mental illness, and also then the economic challenges then made it worse. So with children, we usually see a change in behavior. So a child who was usually happy now tends to be a child that's not as happy. A child used to talk quite a lot and be expressive, and now they're not so expressive. I remember during that lockdown time, there was a 10-year-old who committed suicide. With children, depression has got a very low threshold. For adults, we are looking at 5 symptoms. For children, we are just looking at 2. And in that case, we are talking about sadness and irritability, because a lot of the times children show that things are changing or they're not okay mentally because of simple sadness, crying a lot, and a lot of irritability. He was very irritable. He was fighting with his younger brother. Mom said, stop that. And he took a rope and he hung himself like in the beams of the roof of the house. And it's a very difficult thing for then mom to move past. But the depression was there, but it wasn't seen, because all we were saying is that the child is just irritable. one of the things that creates lasting mental health challenges, even for adults, is when children are hurt and parents do not see. If you come back home and I'm not talking as much as I used to, and you miss that, that's a deep wound for children. Sure. So it's very important to actually pay attention to what's happening with your child. Even school performance, and it was a difficult issue, especially with COVID, because parents suddenly became teachers, and they now had to understand what the teachers have to go through in terms of then supporting the children. There was a lot of shouting, there was a lot of things that were happening, especially with academics and education, that made it very difficult as well for the children to cope. Even learning online was difficult. And so that change and that adjustment made things extremely difficult. And you'd find that again, when children are not doing well, they then tend to externalize their behaviors. So a lot of the times the tantrums that we see, a lot of the times are signs of mental health challenges. Also when we see our children beginning to bedwet, especially if a child has gone past a stage where they used to be bedwetting, we need to actually talk to our children and find out what's happening in their social world because they are doing that. Even when a child steals, and I know we are within a Christian community, we then say that's such a bad thing, you are a thief. But within our frame, when a child is now starting, we don't call it stealing, we call it taking things without asking for permission. Because when you call it stealing, you're labeling. When you label, it sticks. And when it sticks, it becomes a behavior that you struggle to deal with. So we need to find the appropriate language.
Repeat that. When you label, it sticks.
Yes. When we label, it sticks. So we need to reframe it. We don't say you have stolen. We say you've taken things without asking for them. You've taken things without asking for, without permission. And therefore it becomes a behavior that I don't like, but not you being the person that I don't like. Because a thief is a person that I don't like. Sure. But when we call it taking things, you've done something that I don't like, and now I'm correcting the behavior and not actually saying there's something wrong with you as a person. And so there's so many areas and and things that we can talk about in terms of even children. So when I was talking about stealing, where I was going was in that when children steal, they're actually telling you that there was something I used to get that I'm no longer getting. And when you fail to understand that and you just hit me and you don't actually replace what it is that's missing, I'll continue to steal because I'm still trying to tell you something and you're misunderstanding it. So there are lots of behaviors that we'll see in children that will show that something is going on. And then with the women, especially when we are under a lot of pressure, there is a lot of talking, there is a lot of crying, there is a lot of fighting that comes up. I remember there is a book, a Zimbabwean book called Waiting for the Rain, where the author would always start the day with a bedroom scene where the wife would be saying to the husband, you've put your foot in the damned hole again. And she would be talking about the blanket that's torn. And she's saying to him, you've put your foot in that hole again. And in his mind, he would start saying to himself, I know this is a cue that she's trying to pick a fight. And a lot of the times when we find ourselves in that space where we are constantly fighting, where we're constantly quarreling with each other, and there are constant issues between us, especially within the household, we know that there's something that's actually happening with mental health. So the cats, the dogs, and a lot of the times you hear this analogy that the husband has had a bad day at work, he comes home, he transfers the pressure onto the wife doesn't have anywhere to transfer it but to the children to the cats and the dogs, and it goes like that. It's because there is pressure at multiple levels and they're all looking for ways to sort of push it downwards. And in COVID we saw a lot of that. We saw a lot of domestic violence. We saw a lot of people fighting about finances. We saw a lot of people having challenges to sort of contain themselves within the marital systems or even just in life because there was a lot that was going on. And so as Dr. Joe was saying, when you find that somebody is not able to sleep, when you find that they are not able to eat and appetite has been affected, and with these two things we have to understand what he was saying, the insomnia and the hypersomnia. When you can't sleep or when you are sleeping too much. So somebody gets into bed and they fall asleep immediately, in the middle of the night they're up again. We know there's something going on, they can't go back to sleep. Or somebody gets to a place where they sleeping too much.
Can you pause there? Because in the Christian language we say, I was woken up to pray. every 2 a.m. I'm woken up to pray. How
Yeah.
do I separate the two?
Okay, so again here we need to talk about balance, and I think this is the thing that Dr. Chirisa was also then talking about when he was trying to talk to us about what can we say is a spiritual thing and what can we say is actually a sign and a symptom that somebody is having a mental health condition or a problem. So we usually distinguish normal behavior and abnormal behavior by that the symptom begins to cause significant distress to the person that's suffering from it or that's having it. So for example, if we are talking about sleep, right? You know, if you are waking up every single night at 2 p.m. and at 2 a.m. and you are up until 5, and then now that, you know, is affecting your productivity in other areas and other sectors of your life, that symptom has become a symptom that's causing significant distress. And therefore, that symptom is now a sign of mental illness. It's the same thing with things like anxiety, for example. Me being on this platform could be anxiety provoking. Yeah. And it's very natural and normal for me to have palpitations, even as I'm sitting here talking to this audience. But if that anxiety now makes it difficult for me to speak, I begin to shake, I forget everything that I know about the subject. That anxiety has become a symptom that's causing significant distress and has become a sign of mental illness. So if I struggle now to have social engagements with others, so there are many things that are normal. Even if we look at things like jealousy, somebody can say being jealous about your partner and spouse. If I see somebody talking to my wife whilst we're having conference and I feel that I didn't like that conversation or the way that happened, that is very normal. But if that jealousy starts causing me to say, I didn't like the way you were talking to that person, let's clone your phone and every message that comes into your WhatsApp comes into mine, and you know, going to the shops is, it takes 15 minutes, you took 20, what happened to the other 5 minutes? Who were you talking to? I saw you smiling to that person a little bit too much. I think that, you know, you were sending each other signals and things like that. That symptom has become something that's causing significant distress to the person who's having it and to also the person who's at the receiving end of what's happening. So all of these things then help us to define and also then help us to make sense of the signs and symptoms. So there are lots of things that can happen between families, between men and women, but when they start to cause significant distress, this is when I then say this is a problem. So whether our shouting, our communicating, everything that we are doing within the confines of that home or an interaction, when they begin to cause significant distress, we are then saying now, this is abnormal behavior, a sign of a mental illness, and it needs to be looked at. Even cleanliness. You can be obsessed about cleaning things. You can, and with COVID, we saw a lot of that. With fear, a lot of use of hand sanitizer, because every time I walk, I touch somebody, I have to sanitize. I go out, I have to sanitize. When I'm cleaning, everything has to be aligned, everything. If it just goes out by an inch, then there's something wrong with it. Signs that things were not working well.
Fantastic. Thank you so much. I think that helps. Dr. Chirisa, we want to talk about, Bishop has preached before about a subject he calls the anointing can kill you. Pressure at the top and mental well-being, mental illness at the top. What are the symptoms? What are the issues there?
Yeah. Thanks, Doc. So, prosperity is a double-edged sword. And success is a double-edged sword in the sense that when you succeed, you are expecting to ease pain, have more choices, make things easier. And it does. But on the flip side of the coin is that success and prosperity will come with a lot of expectations. Be it success in the marketplace, be it success in ministry, it comes with demands. The demands, because success in itself is difficult to attain. I mean, to be successful is difficult. especially in an African context, it's so difficult just to break through that poverty demon line. In ministry, it's so difficult to be successful in ministry. To have that number, to have that financial flow that will make ministry go into a sweet spot. It's so difficult. That's why so many are vying for it. There's so much competition. And just becoming successful has got pressure. Pressure on the things that you need to know. How many books do you need to read to be successful in your field? I mean, for me to be what I am today, I've got a 5-year degree in medicine, 3 years postgraduate, 4 years master's degree, 2 years MBA, just to become, to be what I am. Spent my whole life, adult life, learning. And you want to catch up because the people that were not as learned, they are
going
there.
there.
I still remember by the time I was finishing my master's, the guys were not done masters, they had houses, and so I have to come now and I have to catch up. Not only catch up, I have to catch up and leave them behind. And that's pressure. and that's pressure. So just being successful, which we push for, in the house we push for success, but you know that it comes with so much, the commitment that you need, and the drive. It will have pressure on you physically. It will have pressure on you mentally. It will have pressure on you psychologically. Dealing with people when your company increases from 10 people to 100 people. Currently, I've got maybe 500-600 people that report to me, or that and this is outside church, and that's pressure that is in the marketplace, and so now when it comes to our context, the black text, you can't leave it out.
Sure.
That's huge pressure. That's huge, because when you're seen on a podium like this, everybody thinks that you need to keep them, you need to send their children to school, you need to rescue them from their foolishness and their mistakes. You become Jehovah El Shaddai, you not him. When you give them $1,000 and say, why did you give me 1,000? You could have given me 10,000. And so there's so much pressure. There's also spiritual pressure, and the higher you go up, most people actually think that you actually have to become more spiritual, because the attacks are much more, not only from your house, but from the industry, from the people that will start to become against you, start to be noticed politically. You've got all this pressure, so you need to put fasting and prayer more than ever before, and because that's how you sustain. And it's easy to succeed, but it's more difficult to stay a success.
Sure.
And that's why we have seen so many people, because the rules and the wisdom that you need to take you high are different from the rules and the wisdom that needs to make you remain at the top. And not only to remain at the top, but to remain at the top for a long time and for a lifetime. Because I would want to remain a success until the day I die. I don't want to go down there. I know how it is down there. And I'm not willing, I'm going to do everything. But I'm putting myself under pressure. So while you might celebrate successful people, sometimes I always do when I'm doing my business mentorship class and say, do you really want to be successful? Because do you know what it takes just to be a success and to maintain that success? Do you know what it takes to be Bishop Tudor Bismark and to remain like that for 45 years? We need to put our hands together for our dad. That's pressure. That's pressure.
That's amazing. That's really, because I think most of us, all of us want to be at the top, but we don't know the cost of staying at the top. Thank you so much for that. But Dr. Joe, I want to come back to you, and we're rounding up. But as we round up, I want your thoughts around the youth. We didn't get time to really discuss that demographic group. There is talk that the youths of today are different from when we were youths. I won't mention when that was. But when we were youths, there's talk that they are exposed to many things, social media, etc., and also access to different kinds of sort of intoxicating substances. Maybe you can take us through what are the issues that you're finding in your practice and what needs to be done. Vongai has already alerted us amongst children, but there's this group, these teenagers, that we really, I was hoping that they would be in the room as well, but I see very few here. But just help us.
Yeah, there's a lot of pressure for teenagers as well, just like there is pressure for people at the top. Just to aid on the pressures for people on the top, these depression issues and mental health issues, they don't discriminate, whether you're young, whether you're poor, or whether you're rich or not. Rich people and successful people have suffered from depression. And notable cases include one of the best American presidents, Abraham Lincoln. He had depression at one point in time, to the extent that his colleague, the lawyer that was working with his friend, actually said, I would see Abraham Lincoln walking down the street, and he was actually dripping down melancholy. Melancholy is a deep state of depression where you can't do anything and you just want to sleep and you can't do anything. So if Abraham Lincoln was going through depression, let alone a youth in the streets, and let alone you and me. So anyone can suffer from depression and mental health issues. So when it comes down to the youths, nowadays there is a lot of exposure. Unlike when you were a youth, Dr. There's a lot of exposure from the internet, social media, and all these things. So they've got access to information. So it's how you access the information, just like a knife. If you put a knife into the hands of a mother in the kitchen, she'll make some nice food for you. But if you put a knife in the hands of a thief, they will murder someone. So the same applies to social media and the internet. These youths, they don't know what to do with the internet at times. So when they get there, they get to know a lot of things, a lot of substances, and then they Google, and then they go and buy certain things. Just about 2 weeks ago, I've got a friend of mine, my banker at FBC Bank. His son was in a relationship with this girl from the neighborhood. So the mother was organizing for this child. He had just finished A-level. He's 18 years old. Wanted to go to the UK or SA for training. But he refused because he wanted to be close to the girl. Yeah. Then the girl's mother did some nest aid training and took the whole family with her to UK. And this guy's like, but I stayed here for you and you couldn't stay for me. Guess what he did? He went on the internet, Googled for what could take his life quickly and peacefully. He went and bought some cocodamol tablets. They've got codeine in them. Took an overdose of those pills. And he was doing that whilst recording himself.
Sure.
Yeah, he was recording and doing a live video to the girl in UK. I'm taking my life for you. Fortunately, the girl could contact some people close by and they brought the boy in, then we managed to rescue the boy. But this is the power of social media that is now affecting these kids. If it was during the old days, you wouldn't know which drug to buy.
Sure.
You get it? And you wouldn't make it so elaborate to do a video call and committing suicide at the same time. So nowadays, the youth are exposed to a lot of things. And I don't know if it's wisdom or wittiness. They now do what are called wheat cakes. They bake a cake for a birthday. And you come in as a mother, you're like, this is the birthday cake, but they won't give you a piece. They eat the cake for themselves because there are drugs in the cake. And they say this one is more dangerous than the marijuana that you just smoke. So imagine the cleverness that they now have and the access that they have. So they are actually prone and vulnerable. So because of that, we need to put more effort in looking at our kids and what they're doing, who they're hanging out with. And at times you see them with these small gadgets. They call them vapors. Yeah. Just a small, tiny gadget that they can put in their pocket, and you don't know what it is. When they're in their room, they can be smoking that thing. Wow. And it's causing damage to them. So we need to be on the lookout for these youths because they are now exposed to a lot of things, and some are using this exposure to do bad things. So it's very important for you to see what are you doing on your phone, what are you downloading, what are you looking at. Yes, I know Vongai said it's not cool for you to be pestering and seeing what people are doing on their phones. But when it comes to your children, please be on the lookout. Because most of these things are happening on their phones, on their gadgets. They could be getting the information while sitting next to you whilst you think you're watching TV together. So it's very important for us to be always looking after our children. And on this note, we should not be like Cain was like, am I my brother's keeper? We should actually be saying, I am my brother's keeper.
Sure.
Yeah.
Thank you so much, Dr. Joe. Thank you so much for that. It's sobering and it's really frightening. I'm glad Ma is here and also Pastor Russell, hopefully somewhere, the custodian of our youth here. This is very important. Hopefully we can have this discussion with them as well. It's very important. Vongai, I just want us to, as we conclude, we're rounding up, in 3 minutes, there's a saying that prevention is better than cure. How do we make sure that we don't get to the place of depression, we don't get to the place of attempted suicides, etc.? How do we make sure that does not happen?
Okay. Thank you, Doc. I think rounding up and just looking at what Dr. Joe and Dr. Chirisa was talking about, and even pressure at the top and all of those sort of challenges, I think what's at the core, and that's important for us to all remember, is that we all have a programming. And a lot of the challenges that we are seeing with mental health are actually coming from that programming. And that programming is something that starts particularly in the first 5 years of a child's life. And so the parenting that we got, whether it's to do with success, as what Dr. Chirisa was talking about, and the foundations that were laid at that particular time determine what happens to us and what happens to our mental health as we grow. So there are lots of things that we are seeing now as adults and in adult years that are actually looking at or coming from that foundation. So we were talking and having a discussion yesterday, Dr. Murisa, about colonization and how that has impacted our ideas of success as Africans. And even as we were talking about the business forum that we had yesterday, we were talking about concepts of faking it till you make it. And these are also concepts that are there within mental health and that we've also adopted. Pretend you're well until you are well. But that doesn't ever work, because what ends up happening is that the illness grows and things just become worse. And even within our looking at finances and dealing with success at the top and dealing with prosperity, it's also some of those things that then kill us, our ideas of what it means to be successful. If I believe my idea of being successful is money and status, what then ends up happening is if I don't have money as a man, then I'm a nobody. And my identity is then tied to the money and the status. So the day the job ends, I can never look at myself in the mirror again. I cannot go home. I cannot look at my wife. If I also then define my husband as just a producer and nobody else, and he's not a human being outside of a producer, then what happens is I'm going to be shouting on top of my lungs that what are you now? You're not even anything. You're a shell of a man because you failed to give me food for the kids, or you failed to pay school fees.
Sure.
So it's these things that are foundational, that are part of our programming, that are actually creating these challenges. And I would urge us to think about these things, to say, what are the things or the repetitions that keep on happening in my life, in different frames of my life? Because those repetitions are signs that there are things that are going on with my mental health, and there are issues that are warning bells that I must look at, whether it's sadness, whether it's repeated failure, whether it's always shouting, whether it's my personality, anger, whatever is coming up and it's repeating itself in many different circles of my life. I must know that those things are signs that there's something that's going on and I must get help.
Fantastic. Thank you so much. Dr. Chirisa, as you have the last word, these are your fellow pastors. What would you address them? How would you address them to what happens after this conference? What issues can they consider in their ministries?
Thank you, Doc. Speaking to fellow pastors and men of God and women of God, I think the time has come to make and normalize the mental health conversation within our churches. People have been suffering for years, and we have not afforded them the help that they need. You might not have the technical know-how, but we are brothers. That's what we are here for. I believe that what we now need to do is to action and to take action on this issue, where we raise awareness within our churches. within our groups, the men, the women, the kids, the youths, because of the drug issue that is happening right there. And we actually can train your people. We have done that. We are certified trainers, me and Vongai. We actually work next to each other. Our offices are at the same place. And so we have worked with each other for years. And we have been training people, because what we do is that there are not enough psychologists in Zimbabwe, or psychiatrists. There are only 17 of us. Psychologists, clinical psychologists are only, the training just started in Zimbabwe recently. The first group hasn't even graduated. But what we are doing is that we are doing what is called task shifting, where we train lay people. And the pastors, because you have first responded when families have got problems, they come to you and you are missing mental health issues. So you need to actually to be trained on how to pick up these things. We can give you some tools. It doesn't matter whether you are in Zimbabwe, we can do it online, or Africa. We can be relevant and give you the things that helps you to help the people that you lead. You are not in that place just to watch, but to help and impact, where it really matters. So what we are expecting from this is that this conversation has just got started. What Bishop did with this conversation is to light a fire. This is not the end, this is just the beginning. More needs to be done, more conversations, the awareness, the training, the implementation. That's where we need to take the conversation.
Fantastic. Thank you so much. I like the fact that this is a conversation that does not end, that is not ending. There's a song that we sing. This is a song that does not end. It goes on, my friend. Yes. So I think it's very important, and thank you so much for raising those issues. There are many other issues we could not touch due to time constraints, to do with policies, etc., but we can always deal with those later. But now I think what's left of me is just to thank my colleagues for really, and let me put it this way, for those who follow newspapers, you'll see an advert for a seminar like this one, where Dr. Sacrifice Chirisa is the keynote speaker. They normally charge $55 to $60 per head, but Mom and Dad made it available for us for free. So we're really thankful for this platform. Because outside of these rooms and these sort of spaces, Vongai and Dr. Chirisa really charge a bit. Yeah? They told you that they just charge to listen to you. So I think we're that privileged that we had this opportunity. But also I think we do not take it for granted that people came to listen. I think it shows that everyone is we are beginning to have our eyes opened, and we're so grateful for opening our eyes and for, like you said, introducing us to the issues that we're dealing with within our churches, within our communities. And this is it. Thank you so much for listening. We are done.
Wow. What an incredible service. We want to thank you for watching this rebroadcast of Jabula International Conference 2022, The Overflow. What an incredible session. And it was one of so many that blessed people. We thank you for being patient with us as we put this program up. Again, please share this message with somebody, like, subscribe to all of our channels, New Life Covenant Church and Tudor Bismark Ministries. And also, thank you for your donations, your giving. Your contributions to our ministry is what makes Jabula Conference and everything else we're doing as New Life Covenant Church and Jabula International possible. You reap the benefits of your sowing, and we are able to do the work of the kingdom of God. We want to thank you. God bless you, and we'll see you again.